Tidak lagi dia maklat kalau saya visiting hours ra hospital. Temel oding lelmer hospital amal mol melsegi de lelol melklora club sale mo with the clock. Agiol ngitrar adal me mesrar adri del new ying alwasi kloarak ta ma sera diraqal oramal protretra magiol ngit mesel omera hospital mo mask.
I see.
Oh yes, way segi de kada matengel wasi hospital abri smer magi diraqal qadiol ngitrar adal ablu wasi sel ome muktakan mamaskar kami mal di segi del tal sigang time ra atal sil sel edel me holding ra adal smeren ar hospital mag melon ngitra aklaing seora ar adara belu.
Okay, direkan niya Claude Rao rengat tel ministry ra tasang MOH ang lorgir. Hindi kami de sodim bol protaktul mora de shura adara belu tasem lama da EOC makasentia demlan mutul reactivate ra EOC. Abesen klelt tel MOH samlamo Ministry of Human Services Ministry of Health and Human Services segi abesen klela tel MOH solang ya EOC bla lutel activate ringir elang mangmalmol Emergency Operation Center sengway se dictate
May sing malway se tulik oy
le toker mlamo confuse adora sa MOH mlore MOC EOC ngargede ekme malgongot toy makasenda eregi mo explain ng irakap sangay
why say yo hindi ang maral mlatsen sa ngak mo Ministry of Health and Human Services among MHHS Segi del MHHS segi del EOC Emergency Operation Center ato dingel was segi dra ongelon melpuil engoram lo olungul kamamamlo o concentrate ra umrus el segi dra bolngal madang atirgagi del terung al positive case eng lilutal mall activated mararing dim lagim closer ngi iwal ko ra dimle dim lagim dissolve ma dim lagi agi dimle ko stand down e ko mo focus ra umrus and this ay al madang al ngarinya a positive case and then nagililutal fully activate mabekal silsel gimitra air chlora tutora ay gagidle Ministry of Health EOC besel ngarinya skogira UL mail sel giril ngarinya testra airport gagidire kalmera EOC magi ngaringil timlak bobol mereka operation airport.
Okay, atara question ritera was if we start having a community outbreak, are we all set and prepared for that? You know, we have enough bed and facilities to house these people if we start having the community outbreak?
Akum dasing lakabay na Amerika update nga kamang kalibay dung til algeran ngul masaka pharma doctor ka malbol albol ko at delivers mo di at telela case management malubeng ko treatment plan ra CRSL Lamer Hospital.
Okay, come on, Sula.
Sulang etulik. So, Dr. Hancock, the question is, how ready is Palau in the event that we get community spread and then we start seeing positive cases that would require medical care? Perhaps just give us a brief overview of what you've assessed and observed thus far with us in the hospital.
Sure, thanks, and good evening, and thanks, Mr. Diaz, for hosting us tonight. So, I think one thing that has been quite evident upon arriving here is that your Ministry of Health and Human Services team has been working at preparing for COVID-19 for a long time, and a lot of those preparations are it's quite evident that there's a lot of good preparation done both on the hospital side of things, looking at evaluating surge capacity, oxygen capacity, looking at alternative care sites. So there's been a lot of thought and planning that happened long ago for that contingency. And so that being said, we always can prepare more. And so we're actively collaborating with MHHS right now to expand preparedness. And fortunately, we're being able to reach out and get support not just from CDC with the U.S. government, but other agencies within the U.S. government. The Assistant Secretary for Preparedness and Response, or ASPR, is also helping out other areas of HHS as well. So we'll continue to collaborate to really help prepare Palau for all contingencies. Again, just to reemphasize, I think people have heard me say it over and over again, but really the best preparedness is primarily vaccination. And so this Delta variant makes getting vaccination even more urgent. If you're not vaccinated and you're eligible to get a vaccine in Palau, know that the vaccines are free, they're available, and they're so important in helping protect you and all of Palau from COVID-19. And that front line of prevention really does help to reduce the strain on the hospital. So I really want to encourage that. Sorry, Mr. Diaz, there's just one other thing I wanted to bring up when we talk about prevention and ensuring that the surge capacity of the hospital is hopefully not even needed, is these monoclonal antibodies. This is a relatively new tool that we have to fight COVID-19. The U.S. government and our colleagues at ASPR are providing it to Palau. And these antibodies are really neat, and I want people to be aware of it. What it is it's a therapy that, if given early on in your diagnosis, within 10 days of folks having cough, it can, one, help you feel better, and two, really reduce your risk of hospitalization by about 70%. So it's that extra layer. The key is individuals have to come in to get the treatment before they get really sick. And I know a lot of people want to hang out at home when they have cough or that sort of thing, and I'm not doing too bad, and it's when they're starting to really feel worse that they roll in for treatment. But for this therapy, it's best if started early. So I think it's really important for people to know that it's available. And if you are someone in Palau, these are for high-risk individuals that are at risk of having severe COVID. So that's people over 65, people with diabetes, obesity, chronic lung disease, those sort of things. If you're one of those individuals, one, make sure you get vaccinated. And then two, be aware that if you do test positive for COVID-19, that there's a therapy that can really help you avoid going to the hospital and make you feel better. You just got to make sure you come in early. So I really want people to be aware that that's available, and of course collaborate with their doctors on getting this therapy. It's an injection, but can really help reduce the risk and burden on the hospital as well. So just wanted to make sure our community in Palau is aware of that.
Okay, okay. Well, thank you, Dr. Hancock. Okay, Kadalman may kapar.
Thank you, Dr. Stein. Anything else that you want to?
Yeah, I guess the other thing that we felt might be important for the community to be aware of is, with the increasing rates of COVID-19 outside of Palau, I think one of our extra layers of protection is trying to reduce the risk of introduction into Palau as much as possible. And I know folks we've talked a lot about the protecting those kids that are under the age of 12, because they are not eligible for the vaccine at this point. And so just want people to be aware of the sort of enhanced entry requirements when people come in. The restriction of movement. One of the new bullets is really to ask individuals to avoid from interacting with kids under the age of 12 until they clear that 5-day restriction of movement when they come in. So that probably wouldn't be too much of trouble for travelers, but I think it's really going to impact your Palauan community. The individuals that fly in to visit family, They arrive, they get their negative test at the airport, they're in the restriction of movement. They want to see their nieces and nephews who are under 12, but during those 5 days, we really want to try to protect those kids from getting infected, so ask that those individuals refrain from interfacing with those children under the age of 12 until they have their day 5 test and are released from restriction of movement. I think that's probably the main adaptation I wanted to share. I don't know, Gafar, if there's others you wanted to share as well.
I think we pretty much covered it.
Okay, the extra question.
Oh.
Okay, flight coming from Philippines is scheduled to arrive here on the 12th of September. The question is, are they going through the same procedure, como tested 72 hours before they get on the flight, and then as soon as they arrive, you guys going to do immediately going to do another test, PCR test, before you release them? When they arrive here, they just arrive here and take a test. If they're negative, they can go right to join the community, the rest of the community. Are they going to be treated differently?
Based on the current MHHS directive 27-21, there's no changes to the entry requirements apart from day 1 testing.
Oh.
So unless that changes, I don't think it changes very much for any traveler coming in from anywhere except for Taiwan, which is under the travel bubble protocol. So at this time, I think everybody coming in would be subjected to the same entry requirements, which is the 3 days before departure, negative PCR test, and fully vaccinated with either WHO or US FDA authorized or approved vaccine, and then upon arrival they are subjected to that testing at the airport. But of course, if things change between now and the 12th, we'll be able to.
Right. Well, we're concerned about it because we all know that we don't trust anybody there. Even us, when we bring the people to work here in Palau, we don't honor their medical report saying that they go through a medical checkup before they come here. But we do our own checkup because due to the fact that we don't trust them to do that. What I'm saying is that we have a representative from CDC or from Palau to be there to make sure that these guys are well certified to do the work, and also vaccine, are they authorized? Because what I'm worried about is that they can just make a fake medical cards for them, and make money, and then we're going to have positive people coming into our country. So sorry to talk like that, but we're concerned about it because we just don't trust anybody. And coming from Guam and from Taiwan, we can't understand that. I trust them in a sense. But coming from the Philippines, we have to really look hard to see if we can designate a company or a doctor that be there to physically see that they do get the shots before they get on that flight. Take that what in Southern Dulil and Adrablua feel that way.
Yeah, mansulang itulig agunda sa segi de un makada seldoru lagi kita policy kada malasamal lomes losim makarang ata doling itagay de roguil kora teto el sabera at malubong tial raktel el low spay emerko sois bandi direct dagi mo dangi lasing brand la confirm segi del flight tendia kam era kada direct kala mo kera Peter ma ministry da MPII lasing malwang rat telela asko gegi direct lo ka dideng sending kora di ka
ya ngara internet ngara gagi dele media lang tumlaw tuji mang 200 tel adang ngar Philippines sigil 12 May ndi hardo togor bela malang lo transtil la adang ngar bitargaw ndi salo maratire kafar kamariter ndi hato maratil ngarinya tlettedir gora amrula ror engela tebel mo sigil dat bigirnya semingital lahan maran sil rusur ngal ave merko el do la brusel hararnya somat sel ngwa harder ngil gerde tial sere sigil gerde motel mal legi de tiar la pesa same problem rela tchegar tire se alge de tiat TV malu betrasino ma emlora oba medical check up tir ma yegi de la garu lid el momdas ul wase endi gede mogorgik lang Kada wala din lor sa safe flight nga uri. Ada tiras mer. Okay? Adal gon ding arab ron dengwa. Please caller 488-4949. Okay?
Daga tuli kaman sulang hindi tilagi dilgera direkal last year sira ora man bloklo agay sira pablul adal rogi dan direkal awal bornya orus et direkal poram lani agay lo sengram bay dia kadi orus sira adal dengar dikal me ending sa igi bay gira dal kut magutmok pergi tra igel morap kurba sepe tra igel sobok lidra al sela balwat mal suku manganyar adal mga plat makaral soy se belo barak te at least tegi damla ruli sa igi dil ngar ale tra al sela balwat al kut basab ak pergi makata direk kal again kadam renga sulir adra belul tet togora orus ay gal bebira belul meliwak pergi damlora point mlomrular wa raffle ma daw tra adal malas memelaktin memelar orus sige tadi akling akum dasa katamal aswar abaredet tiarak tama apalgul tialorus edim lagi del mengum kadamre ngasulir adrabul gidelse.
Okay, me peskemia imora nga bingmewe metamiura raplu we murgowais le gorgomio ikaltoy. Ngaringia dia hal tirgal nga orus makwase ngarau ul mendiah molar tialorus. Senga adra sabado. Makwase mengra what do you mean en wase tial mother nama Pfizer alu ringin mela igagi dele DNA ra babi ka mesai ge o en adras pado mambiase mela tialorus makasen dia timlah lorur ringin ngasen dia ngoise magigi da bebir ra ulla bebir gida tial porolat tialorus len digmam duiba igagi de toil fake news ro todra internet emergorus triar adel mo tirgel man si atogora lidera ndiro mraha atogora lid aku mo tiril mo to seguir Israel membre do lidera adel se sense bedel ma setial chat kafara adim lahan berura babi
tirga ngagi nang toktang artiam la bayung ilte alan to
makam translator mo kira kon
so Dr. Hancock one of the reason for some people who are still not vaccinated, they're hesitant to come in because they believe that the vaccines are being made using ingredients that possibly coming from animals, animal products, especially pigs, or other ingredients that they don't know. Perhaps just shed light on what you know and if whether or not that's true.
Yeah. So they're saying Moderna and Pfizer are made of materials from pigs.
Yeah, good question. I think these vaccines, if you look at the ingredients, they're actually they're quite simple. There's just the bit of the mRNA, which is that messenger RNA, which is just a collection of small acids or proteins that are linked together, and that's what helps, what your body uses to read and make the spike protein that then your immune system learns to fight. The other ingredients are really the little fat particle that the mRNA sits in. There's no other adjuvants or other preservatives in these vaccines. The list of ingredients is really small. And these vaccines in general are, they're all, they're synthetic made vaccines. Of course, the Johnson & Johnson vaccine is a bit different. It's utilizing a virus that doesn't replicate to help deliver the vaccine. But the Johnson & Johnson, the Moderna and Pfizer ones are really just have a few ingredients.
Mm-hmm.